Hi, Miss McLaughlin. Uh, I'm Dr. Supra. I work here at Georgetown Medical Center. What brings you in today?
Hi, Dr. Supra. Nice to meet you. I'm just really concerned with all the increasing cases of COVID, and I was wondering if you could help me understand the virus a little bit better.
Okay, that's fine. I know these are troubling times and that the virus is a new thing that we're dealing with in this pandemic. So what sort of questions do you have?
Well, first, just what exactly is COVID, and what are the symptoms that I should look out for?
Sure. So COVID-19 is a virus that affects your respiratory system. That's mainly your lungs. Some of the symptoms, they're very similar to the common cold or the flu. And some symptoms are fevers or chills, cough, shortness of breath or difficulty breathing, fatigue, headache, things like that. And they usually appear from 2 to 14 days after you've been exposed to the virus.
I'm just worried because I don't know how I can tell if it's COVID or if it's just a cold or even the flu.
That's a great question. I think it's first important to understand that COVID-19 spreads a lot more easily than the flu does. It's a new virus. So that means it's easier to get. It's hard to say because there are so many different ways that COVID can present, especially in younger populations. Some of these things might be sore throat, headache, nasal congestion, cough, fever, and these are all the reasons to be tested for COVID. Some of the symptoms also are that are special about COVID are the loss of taste and smell.
Okay, and if I was to get COVID, what's the treatment like?
Also a good question. So if you're experiencing mild to moderate symptoms, you should isolate at home, drink lots of water, and get lots of rest. Monitor your fever. If your symptoms become more severe, you should definitely go to the hospital.
And at what point could you explain what those severe symptoms would be when I should be thinking about maybe going to the doctor or going to the hospital?
Sure. So you should go to the hospital or consult a doctor if you have like a really high fever, shortness of breath because it is a respiratory disease, difficulty breathing, and if you start showing any signs of confusion, because that could mean that less oxygen is getting to your brain, and you can see that you're out of oxygen if your lips, face, or the tips of your fingers start turning blue.
Thanks so much. And so, are there ways that I can prevent myself from getting COVID?
That's a great question, Miss McLaughlin. Prevention is one of the most important things you can do right now. Since it is a respiratory disease, masks are very important. And I have a mask right here, just as a demonstration. You want a mask where you can cover, that fully covers your nose and mouth. Um, I've seen a couple or instances where people will bring the mask down here, but that's a an effective way to cover it because you're still, breathing out the contents of your lungs into the environment. So that's one thing. Again, if you don't have a mask such as mine, you can use fabric, but you want to make sure that you shouldn't be able to blow out a candle. There is N95 masks, and we're not really advising people use those just because we want to save those for the healthcare workers that are in short supply of those. Masks with vents don't really work. Those actually release the disease. Um, and anybody should be wearing masks when public. And if you're out in public gatherings or with friends, you should always try to maintain 6 feet apart distance. I'm pretty sure you heard a lot about social distancing. And when you're washing your hands, you want to wash for at least 20 seconds or humming, or what I like to do is hum happy birthday twice. And then always keep a bottle of sanitizer with you whenever you're going in or out from your house.
Okay, great. And I've seen a few people walking around with those face shields and some with the neck gaiters that they pull up. How do you feel about those? Are those protective?
For right now, the CDC is telling us those don't actually work.
Okay. And then if I'm around my family, do I have to have a mask on?
That's a good question. You only need to be wearing a mask if you are with people that don't live within your household. So if you're with family members who don't live with you, then I recommend staying masked and keeping 6 feet apart.
Okay, sounds great. And then I've been hearing a lot about all the different types of testing. Can you tell me a little bit about them and what exactly like the antibody test is?
Sure. So there's two different types of tests, the viral test and the antibody test, like you just mentioned. The viral test checks whether or not you currently have COVID-19, and while the antibody tests whether or not you've already been exposed to COVID-19.
Okay. And what do each of those tests involve?
So the viral test, it's usually done with like a nasal swab. I'm pretty sure you heard about that. And they usually stick the swab up in your nostril, kind of just move it around to see if you have it or not. Um, and then there's also some tests that now use your saliva. On the other hand, the antibody test is a normal blood test, um, and like what happens when you get your blood taken.
Okay. And then I've also heard something about rapid tests. What are those for?
So the rapid test is testing whether or not you currently have the virus. It's called rapid because you get the results back quick than a normal test.
Oh, okay. That makes sense. And so when should I go for testing? Like, do I have to be sick?
You should go for testing when you start to develop the symptoms I mentioned earlier, or if you find out that you're around someone who's tested positive for the virus, meaning they have the virus. Also, it is important to remember to wear your mask when you are going to get tested so that you protect others in case you do have the virus.
Okay. And do you know where I can get tested?
Yeah, there's many different places around the city where testing is being offered. I could send you a list, and you could probably find something close to your home that have drive-in options or drive-through options where I think you swab on your own through the drive-through and give them the sample. There's also places where you can get testing done for free.
Okay, that's great. I was a little worried because I was scared to go to a testing center and be surrounded by a whole bunch of people with the virus, but I like those drive up and walk up options. So I'll definitely look at that list. And then you said insurance is covered, so are the tests expensive?
So most insurances cover the cost of the test, but there are also many free options at firehouses if you don't have insurance or if your insurance doesn't cover the cost. You can find the firehouses with testing on the link I'll send you that I referred to earlier.
Oh, great. Thank you so much. So now what do I do after I get my results, whether it's positive or negative?
So let's first talk about if the tests come back positive. This means you have the virus. You'll need to quarantine at home for 14 days. It's also important to quarantine for 14 days if someone that you live with tests positive for the virus. And additionally, you should stay away from your family members. If you can isolate yourself in a separate room from your family members, that is best. Also, if you can designate one bathroom for yourself, that is also great too.
Okay, and so if the test comes back negative, though, that means that I don't have COVID?
So unfortunately, that's not always true. A negative test doesn't necessarily mean you don't have the virus. The result can be a false negative, or you can have gotten the virus between the time you got tested and when you got the results. For this reason, it is important to quarantine if you have any symptoms or if you come in contact with someone who has the virus. Quarantine is what helps stop the spread of the virus.
Okay, great. Thank you so much for all this information. I really understand it a lot better now.
No problem, Ms. McLaughlin. That's what I'm here for. Remember, it's important not to panic during these scary times, but to instead be careful. That's where prevention comes in. This includes wearing a mask, social distancing by keeping 6 feet away from people, getting tested, and quarantining if you test positive or if you've been in contact with someone who has tested positive. And please don't hesitate to reach out if you have any other questions.
Okay, great. Thanks so much, Dr. Supra.
Thank you, Ms. McLaughlin.